I saw a TikTok from a therapist who was saying that they see it as somewhat of a concern if somebody has been in therapy for a year and still doesn't know when they are going to be wrapping up therapy. They were talking about how the average duration that they see clients for is 6 months to a year, and so it's weird to them how many people online will say, "Oh, I've been seeing this therapist for 5 years," or other like long lengths of time, because that just makes them wonder why you aren't progressing or why you're still needing therapy after that long. And I thought that was really interesting. And I kind of thought that a therapist that I saw just for like 2 sessions in my early 20s and then decided that that therapist just wasn't for me would agree with that, because on like the intake, he asked me if I had done therapy previously, and I shared that I had been in therapy for about 4 years as a teenager with like one therapist. And he said, and clearly that didn't help you that much if you're like coming back to therapy. And that is actually one of the reasons why I decided not to stick with that therapist, because I absolutely got a lot of benefit out of that 4 years with the therapist that I had as a teenager. I have very fond feelings for that therapist and for how they helped me, and that experience gave me a lot of just like positive regard for doing therapy in general. Um, I do think that I've been able to progress more in therapy as an adult than I was as a teenager, but I feel like that was just because I was a teenager and my I had limited coping skills, and there's so many factors, I guess, but I don't at all feel like the 4 years of therapy that I did as a teenager were like a waste, or that I was being taken advantage of to like give my therapist a paycheck or anything like that. And anyway, I just thought it was interesting that apparently there are therapists who think that therapy should be a pretty brief experience. And I've been with my current therapist for a little over 2 years, and there are times where I very briefly, I think just out of like anxiety and kind of perfectionism, will ask myself like if I'm progressing fast enough, or if I should somehow be doing more, healing faster. But I really think that's silly, because when I look at like any 2 or at least 3 month period of therapy, like where I'm at now versus where I was at 3 months ago, I've definitely seen clear improvement in my mental health, in my coping, in my processing of traumas, of just various different things in that time. And that's always been true. So, like, I would say every 3 months of the last 2 years, I could pinpoint specific gains that I've made. So, it's not at all like I'm just like stagnating or plateauing and just like, you know, talking to this person about what I had for dinner, or, goofy, pointless things. It's like we're doing real, like, productive work. It's just a long process. Anyway, and I wouldn't usually mention that kind of a thing to my therapist, but I was kind of intentionally trying to keep my therapy session light this week, because I have other things that I need to put emotional energy into more than therapy, ironically. But I still thought the response was really interesting. I thought it was worth sharing on here. So they said that they have definitely had clients who will just have 6 months worth of therapy, or even just like 3 months of therapy, or a year of therapy, and then be done. And they said that sometimes that is because there really are people who really have very minimal trauma and will utilize therapy for one quite specific and limited, like non complex goal. So they said, like, for example, if somebody doesn't have like childhood trauma or much like past issues, they have lots of really healthy relationships and stuff, but they lost a job and that is like impacting their identity or their sense of self worth, they might do therapy for a short period of time just for that one issue, and it's not very complex for them. Or if they are grieving, or had a breakup or something like that, that sometimes there is really just one limited issue that they'll want to address. And then they said the other thing, though, is that a lot of people do have more complex issues, and they'll come to therapy and they will happily address the kind of like higher levels of their issues. And um, and then once they have gained a coping skill or processed a like higher layer of their trauma, or have seen some growth, then they will sort of start to get to the next layer. And sometimes that is too scary, or it's just not work that they're interested in doing. And so they will just decide that that they're happy with the progress that they have made, and that they're just done for now. And my therapist said that, like, as a therapist, they can see, like, you have more layers of work you could do here, but it's not their job to tell people that they should do that, because we get to decide what works for us as clients. And so if they're okay with just healing the top layers for now, at least, then that's totally valid, and they can graduate therapy, and that's perfectly fine. And so a lot of people do that. And they said that specifically an area where a lot of people will work to and then decide they are done with therapy is once they kind of get to a layer of recognizing like dysfunctional family roles. And that they think that is because it is so disruptive, or can be so disruptive to their social support, their support network, if they try to start stepping out of those roles. And so that is a type of work in therapy that can be extra scary. And so that is just a particular point where a lot of people just decide, like, this is just going too far, and I'm ready to just stop here and call this good enough. And I thought that was particularly interesting because that seems to be the phase that my partner and I are currently at, and we are not stopping the work here. We're continuing to keep going. So that was pretty validating, and just interesting, I guess, to get a little bit of a peek behind the curtain of how at least my therapist looks at something like that.